New onset low back pain. So this is acute low back pain that just hits you out of nowhere. You may wake up with it, bend forward to brush your teeth, pick your kid up. Just sometimes it's the most benign, innocuous, uneventful thing. And your back seizes up and goes into pain and you're in complete agony. You don't even know what hit you. You've never had it before. So that's what we're talking about here. Not a chronic back issue with other issues. This is just back pain that came on like that. And it happens to just about every person at some point in their lives. So what causes it? Typically, the severe back pain is a tear in the disc called a lumbar annular tear. The outer part of the disc is the annulus fibrosus. It's a tough woven basket. The inner part is the nucleus pulposus. It's more shock absorbing and gelatinous. Discs are amazing structures. They do so much. Every time we move and walk and talk and jump, this action is occurring through the disc. And that's why the disc has two different components, because it serves so many different functions to provide for that. So the tear in the annulus, you get a tear in this woven basket, it releases acidic chemicals that can irritate the nerves, which can cause some pain down the leg, cause pain in the back as well. Then the muscles lock down to try and stop you from moving, and you can get muscle spasm and muscle tightness and muscle pain in addition to the disc pain. Typically it hurts worse when you sit, because when you're sitting you load the disc, but it also hurts anytime you move and twist and do anything in the back. Red flags, things we really worry about, are if it wakes you up in the middle of the night. If it's worse at night and it's night pain, it can be indicative of a tumor or a cancer. Other things we worry about is loss or bowel and bladder control. If you lose your urine and feces, you can't control it, obviously go to an emergency room. And also we look for weakness. Do you have a foot drop, weakness of your thigh, weakness of your calf? That's more indicative of a herniation hitting a nerve, which may be more likely to need surgery. But the annular tears, or the tear in the disc that causes the back pain, that's typically 90% of people who get severe low back pain. That's what's causing it. You have a lot of other structures in your spine. In addition to the disc, we have 2 facet joints for every disc. Those are in the back. Those can hurt if you lean back and load that side, but these joints are so much smaller than the disc that usually they're only around 5% of people's pain. 90–95% are coming from the disc if it's really severe, acute, new onset back pain. Your SI joints are off to the side. A lot of people think they hurt their SI joint because the pain, they feel it right off to the side, right in that dimple of their buttock area. That's typically not the SI joint, because the SI joint barely moves. So it's rarely the source of real severe disabling pain. And more of a hyperlaxity chronic issue, and people with some type of arthritic condition may have SI joint pain, or if you've had your whole back fused, maybe SI joint pain. But most normal people, new onset, really bad pain, it's not their SI joints. It's a disc that has a tear in it, and that pain is referring to your SI joint into the dimple in your buttock area. Why? Because the same nerve that innervates the disc innervates the skin and muscle in that area, so it's referred pain. That's where you feel it, but it's the disc that's causing the pain. So how do we treat it? We start with stop doing anything that causes any pain. And that's what your body's trying to tell you on its own. It locks up, and so you can't move because it's trying to protect you. Because what you don't want to happen is to get the tear to be bigger, which can be a herniation, hit a nerve, cause weakness, numbness, pain down the leg, which is more likely to have surgery. So if you get severe pain, cool off, just let it heal. Plan on giving it several days, maybe even a couple weeks, whatever it takes, let the pain subside. We treat it with anti-inflammatory medications typically, and every person's condition is different. It depends on your underlying medical issues, but we do anti-inflammatories. We also do steroids like a Medrol dose pack, prednisone, muscle relaxants, pain relievers, nerve medications like gabapentin. Those are all options. They all work a little bit differently, and a combination of those helps each individual person. It has to be tailored for your individual case. If you're not getting better with the oral medications, and then we do an epidural injection, which is a steroid cortisone shot in the spine around the disc and the nerves, and it can be more effective than the pills, and it can last longer. After that, we do physical therapy. Get your core muscle strong to take some stress off that injured disc. We go slow with that. Our whole program in our app called The Back Doctor starts in a neutral, pain-free position, so you're not as likely to hurt the disc. We don't want you doing a bunch of sit-ups because that flexes through the disc and may injure it. Our program, you learn how to lock your muscles in a neutral, pain-free position, which doesn't stress the disc. Move your arms and legs and balance and coordination. That's how you protect the disc. And that whole program is in the video, the lumbar spine rehabilitation video. If someone's not getting better, then typically we'll get an MRI and we'll take a look and see, do they have an annular tear in the disc or do they have a herniation? And that's really when people need a physical exam to know what exactly is causing. So you have two options at this point. One is to reach out to us. You can email us at info@watkinsspine.com. The other option is to look at the lumbar rehabilitation video. Thank you.